Great. Welcome again, everyone, and thank you for joining us today for a Boost webinar on human resources for effective vaccine management. My name is Liz Colway, and I'm Manager of Community Building and Digital Engagement at Sabin Vaccine Institute, primarily managing the Boost online platform, boostcommunity.org. Before I introduce our speakers for today, I'd like to go over some housekeeping items for the webinar and just also get a sense of who we have in the audience today. You can submit your questions throughout the webinar through the Q&A located at the bottom of your screen. You can also respond to questions and engage through the chat at the bottom of your screen as well. Please raise your hand if you'd like to speak, but we do ask that you mute yourself unless you are speaking to limit background noise and feedback. Feel free to ask questions throughout the presentation. We've reserved a bit of time at the end to address them. If we don't get to all of your questions, we will be sure to follow up with answers along with the webinar recording and presentation in the coming days. Just a reminder that this webinar is brought to you by our supporting supervisors during COVID-19 Boost Learning Group. Together with immunization experts and partners, we created this new learning group to support you during these challenging times, addressing the challenges caused by the COVID-19 pandemic. You should join this group if you are a supervisor working in your country's immunization program at any level and would benefit from tools, resources, and discussions designed to help you and your team work more effectively as you strive to offer quality essential immunization services. You can follow the link that's on the screen in front of you, and we'll also set this out after the webinar to join the group on the Boost community platform. So thanks to everyone who's introduced themselves in the chat box so far. We just have a few additional questions for you, which will help us guide the discussion. We'll allow for about 30 minutes or 30 seconds, I should say, to do this poll. So be sure to pay attention as it comes up on your screen. Thanks for those who have answered the polling questions so far. We'll just allow a little bit more time so some folks can answer the questions. Great. So just sharing the results, you should see them in front of you. It looks like we have a mix of folks coming from different regions around the world. As far as positions go, it looks like we have a number of technical officers and advisors, but also a number of supply chain officers, consultants, and also a few EPI managers as well. As far as the greatest human resource challenges, it looks like it's pretty evenly split. We have a few listed around skills, staffing, working conditions, and motivation, all of which will be addressed during the forthcoming presentation. So thanks again for everyone's participation in the poll. So without further ado, I'd like to introduce our speakers for today's session, Adebayo Adekola and Dominique Swinkles. So Adebayo works as a capacity development specialist with UNICEF Supply Division. He has 14 years of experience in capacity building, organizational development, and performance improvement. In UNICEF Supply Division, he's responsible for organizational development, human resources, leadership, and technical assistance frameworks to support efforts at ensuring quality health and essential supplies for children as part of the national supply chain strengthening strategy. And Dominique is the executive manager of the People That Deliver initiative. She's an international development professional with 22 years of experience in managing programs with a focus on health supply chain management, livelihood, food security, and nutrition. Since 2016, Dominique has been responsible for the management and overall performance of People That Deliver, a broad coalition of governments and international, regional, and national organizations working together to raise the profile of health supply chain workforce as a key strategic area of health systems. Thank you both for joining us for today's session. And now over to Dominique for an overview of today's session.
Okay. Hi, everyone. I hope you can see me. Okay, great. So thank you, Liz, and thank you to the Boost community for giving us a platform to discuss the strengthening of the health and supply workforce to ensure availability of vaccines, as well as improving employee capacity and retention. The Boost community is a great example of a community of practice where professionals can connect and learn from each other. As you heard, my name is Dominique Swinkels, and I'm the Executive Director of the People That Deliver, PTD for short. It is a coalition of like-minded organizations that is working towards strengthening the capacity of the health supply chain workforce while promoting the professionalization of the supply chain role within the broader health system. We advocate for a systematic approach to human resources for health supply chain management, and we are the technical leader for human resources for supply chain management. As you heard, we are hosted by UNICEF Supply Division, and we work very closely with the Supply Chain Strengthening Center at Supply Division, where Adebayo is located in. And we are governed by a coalition of organizations representing a variety of different constituency groups, from donor and aid agencies to implementing partners, academic institutions, professional associations, and the private sector. Could you give me the next slide, please? Today, we're hoping to have an engaging discussion, shining the spotlight on human resources for supply chain management requirements and considerations that are necessary to, as we see a new vaccine being introduced to combat COVID-19, or as we all know it, COVAX. As we know, the immunization program is at the forefront of the COVID-19 pandemic and anticipation for COVAX. Countries need to prepare for the introduction of COVAX along with routine immunization and campaigns. The introduction of a new vaccine, of course, impacts program planning, budgeting, cold chain systems, and of course, what we look at, the workforce. In preparation for COVAX, we're not oblivious to the current challenges with the workforce, the limited personal protective equipment for safety, for instance, staff shortages, poor motivation, inadequate compensation, attrition, and limited capacity. During the presentation, we're going to be looking to answer some of the following questions. How can we prepare the health and supply workforce in anticipation of this vaccine? What critical elements should be put in place to strengthen HR to ensure availability of vaccines, cold chain, and related commodities within the EPI? And then finally, what actions should countries prioritize in the coming year to improve HR availability, capacity, and retention, especially at the sub-national levels? Next slide, please. And so I'm going to start off with this slide. The supply chain really requires many professionals. An important health worker that's often overlooked, but necessary for the continuation and expansion of health services and supplies, is the health supply chain worker. As new investments are made in technologies, innovations, new drugs, IT systems, and much more, who's actually doing the work? Who is trained and has the right skills and competencies for these? I've started to list them on this slide, but as we know, there are numerous roles up and down the supply chain, and PTD's newest resource, which I've listed here, the collection of roles and job descriptions for health supply chains, lists up to close to 70 roles and responsibilities. The supply chain workforce includes a variety of people who are dedicated to fulfilling supply chain and logistics activities at national, district, and health facility levels. It also includes key personnel who contribute only a portion of their time to supply chain functions. And of course, these include pharmacists, logisticians, supply chain managers, data managers, warehouse transportation personnel, and of course, many, many, many more, all of whom are collectively tasked to ensure the appropriate commodity selection, forecasting, procurement, storage, and distribution of health products. The WHO Roadmap for Access to Medicines, Vaccines, and Health Products 2019 through 2023 highlights the lack of specialized skills that are required for the procurement and supply management of quality assured health products. Preventing, detecting, and responding to shortages of health products is a major challenge. An efficient and inefficient supply chain can lead to high levels of wastage with significant consequences in terms of access. This roadmap supports a workforce that is fit for purpose in key areas such as procurement and supply chain management, with skills to forecast needs, develop procurement processes for warehousing and distribution, stock management, maintenance, and more. A workforce that is fit for purpose at all levels of the health system, including both supply chains, upstream, so working with suppliers, and downstream, reaching the patients is very critical. On this slide, I have several skills listed that are critical to this need, from planning to maintenance. Next slide, please. I think it's important to highlight why we focus on human resources for supply chain management. As we know, supply chains are the key enabler for all health programs. You may have heard the tagline, no product, no program. Supply chains for health commodities are particularly important for the delivery of health commodities. If you do not have the right people with the right skills running those supply chains, supported by appropriate human resource policies and supervisors to monitor those people and ensure that they are motivated, you will not have a well-functioning supply chain. From research that we have done within the people that deliver, the following challenges all cause a reduction in supply chain performance because of workforce-related issues, such as the fragmentation of the responsibility for managing the overall performance of the supply chain, lack of planning and financing for the workforce, lack of development and credentialing for supply chain managers, lack of accurate job descriptions, and then the lack of professional development and professional associations. Next slide, please. The COVID-19 pandemic has placed an increasing pressure on health supply chains. As I mentioned in my first slide, preventing, detecting, and responding to shortages of health products poses a significant challenge. The movement of goods across the global supply chain have been disrupted due to restrictions of movement, as we know, through air, sea, and land. And the operating environment has also become increasingly complex. Health supply chain staff are doing their best to maintain the availability of critical supplies despite these hardships, and are an essential part of the COVID-19 response. For the health supply chain workforce to safely procure and deliver supplies, they must be given the same protections as all essential workers. And we therefore advocate for supply chain workers to be included in the list of critical staff required to ensure the continuation of in-country supply chains and logistical operations. Human resources for health and the health supply chain workforce constitute the very first line of defense against international health crises. They are key to health systems resilience and to implementing the core elements of the international health regulations. COVID-19 response policies, plans, and guidelines cannot overlook the need to support these essential workers. The health system relies on them for the availability of medical supplies and equipment, as they will be the ones responsible for dispatching a treatment or a vaccine when one becomes available. Having a competent, adequately staffed supply chain workforce means that other cadres with clinical roles can concentrate on treating patients. Next slide, please. And so I now would like to turn your attention to the PTD Building Human Resources for Supply Chain Management Theory of Change. A theory of change simply explains the pathway through which a specific result can be achieved and shows the chain of events that exist between a program's interventions and its goals and desired outcomes. In general, we need to know what is the change we're trying to create, and we need to have a clear hypothesis about how that change is going to occur. More specifically, we need to be able to describe the impact of interventions and investments in human resources for supply chain management that aim to improve supply chain performance. The top green box is the ultimate goal. Health outcomes are improved. We want to enable this through continued commodity availability. That is the purpose of everything we are trying to achieve here. The top dark blue box is the long-term outcome. Work performance is optimized. The theory of change is not a supply chain improvement program. It's really a tool that you can use to design one of those improvement programs. But you must still design the program, develop the specific interventions and activities, and map how you're going to move through them, sequence them, prioritize them, and all of that coming together. Any such process is a change management process and should be undertaken with some understanding of how you're going to manage that change overall. Next slide, please. So the content of the theory of change really lies here. These are the 4 distinct pathways that lead to that ultimate goal: staffing, skills, working conditions, and motivation. What is within our realm of influence and our control is that work performance is optimized. The idea being that if we're able to achieve optimized workforce performance, we will be well on our way to ensuring commodity availability. So what we're trying to do is that workers are motivated to do their jobs, working conditions are supporting performance, staff are applying their skills at appropriate at every level of the supply chain, and that all necessary supply chain positions are filled. The theory of change assumes that there's an interdependence between each of these 4 pathways, and that making strides, improvements in one area can lead to improvement across all areas. So they must be approached in parallel to achieve a successful change. For example, as I put down in this slide, skills are essential to workforce performance and may be fostered by training. However, skills alone are insufficient to meet the long-term outcome, particularly if working conditions are not optimal or if supply chain positions do not have adequate staffing. Next slide, please. And so now that you've seen the theory of change, I would again like to look at the challenges to the health and supply workforce through the lens of the theory of change. So when we look at staffing, there's limited recognition of the supply workforce. There are staff shortages, there's attrition, there's limited HR information for decision-making. When we look at skills, there's outdated job descriptions and SOPs, poor visibility on available trainings, and limited supportive supervision. Under working conditions, there's a lack of work tools and a high risk of infection. And then for motivation, there's heavy workload and low salaries. And I think I saw in the poll that the highest number was, let me see. Let me just find my notes. Was skills. And so very clearly, look at the challenge of skills, and we see outdated job description and SOPs, that poor visibility into available trainings, and that limited supportive supervision. Those are very key challenges that we see often coming up. Next slide, please. So I just wanted to provide an example under the staffing pathway. And also provide you an example of how to apply the theory of change in the staffing pathway. As we know, there's increasing pressure on health supply chains. Current stressed supply chains are becoming more stressed with the increase of products flowing through them. These charts are showing you an example of how a 24-fold increase in the value of new vaccines introduced into a country resulted in a 5-fold increase in the workload for supply chain management in a country. This is data from Chad, but it demonstrates that decisions to increase the availability of health commodities in a country must take into consideration the ability of the supply chain workforce to absorb the extra workload, which might require expanding the workforce, or in some cases, reorganizing the workforce to make it more efficient. And all too often, the supply chain workforce is not considered when decisions are made to introduce new or more commodities into the system. With the introduction of COVAX, and as new treatments become available, these specialized skills are necessary to ensure their quality, safety, and efficacy, and their efficient procurement and supply. Once a drug is proved safe and effective, getting it to millions of patients around the world requires massive manufacturing and supply chain management capacity. Therefore, we see that there's a need to apply the theory of change to assess workload and responsibilities, and also forecast staffing needs. I have listed on the slide several tools that are available for such exercises. Next slide, please. And finally, I would like to point to several tools that we have available to support your use of the theory of change. These can all be found on our website, which is www.peoplethatdeliver.org. A full narrative, which contains the indicators and interventions catalog. For each box in that map that I've shown you on the previous slide, and also a smaller version on this slide, you can map potential indicators that you can then use to measure impact at each level. If you're going to design an intervention at any of the levels, here are some indicators that you could use to consider using as a basis for a systems-focused performance assessment, or as a monitoring and evaluation if designing interventions along these pathways. We also have a 2-pager that supports advocacy efforts. And we also have an explainer video, which is available both in English with subtitles in French. And so now I'm going to pass it on to my colleague Adebayo, and I look forward to any of your questions and feedback. Thank you very much.
Yeah. Thank you so much, Dominic, for laying the foundation for all of the discussions today. I just want to also acknowledge all the participants on this webinar. I see a lot of countries and interesting countries also. I see Syria, St. Lucia, Tanzania, Zambia, Pakistan, India, Nigeria, Egypt, South Sudan. A big welcome, and it's good to have you all here with us. So going straight into this conversation, Dominic has laid the foundation around what we call the People That Deliver theory of change, that focuses on skills, staffing, working conditions, and also motivation. Now we are going to bring it home to how all of this applies to the immunization program. And so on this slide, you would see the overview of the 7 components required for effective immunization programs. And of course, it's covers program, human resources, vaccine supply, service delivery, immunization coverage, disease surveillance, and demand generation. Now, if you move on to the next slide, one thing is common across all of these elements. You would recognize that HR plays a big role in all of those components within the EPI program. However, what we've seen, we're still on the previous slide, but what we've seen over time is that many times the HR is given the least attention in many cases. And many times there is actually limited planning for the human resource. As we know, human resource planning, capacity building, and supportive supervision is quite key to the entire component, and even to the cold chain management of the vaccines, supply, transport, waste. HR is a key component at national level, sub-national, and the service and at the service delivery point. The next slide. So COVID-19 has shown us a lot of things. It has changed the lives of many people. It has changed, the way we approach work. And of course, the immunization program is not excluded from the effects of COVID-19. Of course, many countries had to suspend campaigns as a result of the COVID-19 pandemic. And so right now, from what we've gathered from countries, there are certain priorities that countries are beginning to focus on as they move on. The first is health worker safety, the need for protection of the health worker, because not just health worker, but also the supply, workforce, ensuring that, people are safe to work and, they, of course, maintain the necessary guidelines to protect them. The next one is around still maintaining routine immunizations and campaign through, the program, because at the end of the day, we are all trying to save the lives of children from vaccine preventable diseases. So it's really, really key that we maintain immunization programming. It's not just COVID alone, but ensuring that every other necessary vaccines required is available within the country. Okay, the next slide, the next point is also now, there is so much focus, and I know a lot of you on the call would definitely agree with me that there's a lot of work around country readiness and introduction of the COVID vaccine. And there's a lot of discussions ongoing around that. So that's also a priority for many countries. The next point is around the new world of work. People have had to change the way they work, physical distancing, visual working, remote work. There's just so much going on as regards how people work. And that also is a priority for many countries as we think about how COVID is affecting our way of life. And the last point, is around ensuring that we reach the last mile. Despite all of this, we still have to ensure that children are safe, people can get vaccinated, and that last mile reaching the communities, reaching the health facilities is very, very important. And countries have continued to prioritize this key action. Next slide. So as we talked about, we've looked at those priorities that countries are really looking at as we walk in this new norm. But it's also important to look at three major areas that affects human resources. We've talked about the point around staffing, having the accurate number, having the adequate skills, having the right working conditions, and also making sure that people are really motivated to work, because in many contexts, sometimes it's also motivation that affects the entire program. And so as we look at these areas, what are the things we should begin to think about? What are the job roles required to ensure that vaccines are available and they are also kept in the right quantity, which of course speaks to the cold chain system? And also, in terms of what does it take to reach the last mile, from the national level to the sub-national level to the health facilities? And the other point is around the amount, the quantity, and the quality. So I would emphasize that quantity and quality of the human resource required to ensure that we can go through from forecasting to getting to the people who need them. Important in this aspect is also management and leadership. You would agree with me that a lot of decision-making is ongoing at the moment. A lot of decision-making is required within the EPI program and every other health program. And so it's important that we also put the spotlight on management and leadership, because that's where decision is made. And so it's important that that is also a key part as we think around how to improve supply chain systems and how to improve availability of vaccines, and especially the COVID vaccines also at this point. And the last point is around resource mobilization and allocation. How do we make sure that there is enough funding, financing for, for the human resource? Because you would tell me that, people need to be motivated, but one element that affects motivation is payments, is salaries, is compensation. People need to, take care of their families. They need to ensure that they have adequate, funds to take care of themselves. And that's quite key, even within the EPI program. So now one of the things we wanted to make sure that you take home from this webinar is the need. What are the things you should start thinking about? What are the key actions you should take? And so the next slide would focus on what are those things you should focus on. So using the people that deliver theory of change for staffing, the first point is around planning. It's important that you plan adequately for any form of upsurge or surge in human resource required. Because as we know, an introduction of vaccines would definitely require that you look at your cold chain capacity. And many times you have to think about not just cold chain, but warehousing capacity, transport capacity, distribution capacity, even general programming capacity in terms of human resource. So you need to be sure and be clear about the number required, the additional number required, to make sure that you can manage the workload. Because one of the major challenges with the staffing is the workload of health workers. Even the EPI workforce also complains about workload. So, and in this time where we also have a lot of scheduling, physical distancing, remote working, we need to plan accordingly based on the workload. The other point is around budgeting. Right now, countries are budgeting, depending on whether it's the government funding or whether it's funded by donors or by partners. It's important that we make sure that all of these plans are reflected in our budget processes. But importantly, is also having it clearly defined in the country plans, because you already have your annual work plans, making sure that you have specific actions to improve your staffing capabilities. And also there are innovative staffing approaches in terms of secondments, in terms of tax shifting. So you need to look at those innovative staffing methodologies or ideas to drive availability of staff for the work that you're going for the immunization program. The next point is around skills, and I looked at this the survey or the poll, and skills came out first. Now, what I've seen over time in terms of, in not just immunization program, but health program in general, is that we always have a list of trainings. But what the main challenges is usually that, are those the trainings that are required? And that's where the gap analysis is very critical. What skills do we need to ensure that the cold chain works, is in optimal condition? How do we ensure that we can manage temperature monitoring? How do we ensure that people understand the inventory management and stock management processes? Those are very important. The second point is around the training plan. And when people talk about training plan, they put the numbers, the type of training, and the budget. But a training plan is not about that alone. It's also about how do we go about the training? Do we have job aids? Do we have trainings in the language that people understand? Do we have it in the local language? These are points we need to focus on, because many times the focus is on those lists, but many times we don't look at the how. The last point is around supportive supervision. How do we ensure that there is that, sub-national supportive supervision through the work that, people are doing, through their daily task, through what they do on a daily basis? How do we ensure that supportive supervision is there to help them through? The next point is around working conditions, and I'm going to run through it, which focuses on infrastructural needs. A lot of you probably at the moment are probably, trying to look at your coaching capacity in readiness, looking at your coordination mechanism, looking at what are the training needs, what are the, capacity needs required to ensure that you have adequate supply of not just COVID vaccine, but just the immunization program as a whole. And some of these are reflected in your country multi-year plans. So it's important that you are clear about the infrastructural needs. And it's not just to say, oh, we have capacity. You need to have a storage, assessment. You need to know what is available, what you need, and you need to be clear to, leadership about it. You also need work tools. In this new world of work, you really need to have good work tools. Internet, the laptops, your documentation, general good working conditions. These are things that you need to advocate for. And the most important point, of course, out of all of this is making sure that we pay attention to infection prevention and control, which is very, very key. We need to adhere to guidelines, make sure that, personal protective equipment is available, and we continuously advocate for it. Some of us might say, I work at national, I don't have the power to do this, but you can continue to advocate. And I know that your voice will be heard, as you continue to advocate at all levels. And the last point is around the motivation, which basically is around how do we reward people? How do we ensure that their salaries are paid promptly? But it's not just about financial, it's also about non-financial, encouraging people that we work with, providing the support they need, being, mindful of, their needs, psychological needs is quite important at this point. And also ensuring that we are clear about the performance, about what we expect from them, because many times people say, and that's what boils down to the point around the job descriptions. People sometimes have job descriptions that, were probably written in the 1980s, and we are in 2020. So we need to look at those elements. And even with the introduction of the COVID vaccines, we need to go back and say, what do I need? These are very important points that we need to focus on. Next slide. So for more information, we want to hear from you. For more information, we'll definitely share with you, and some of you might have seen it already, but we want to also let you know that there is HR and leadership brief that you can also check with specific actions that you can take at national level and also at sub-national level. So next slide. Of course, Dominic has spoken about the People That Deliver coalition that involves a number of organizations, including UNICEF, Gavi, and many other organizations that continue to work with countries around the issues of supply chain, health supply chain. And of course, the aim is to create a competent, supported, and adequately staffed supply workforce that is deployed across the public and health private sectors. The major point we also should note is that every health worker has a role to play in ensuring supplies, because where there is no supply, there will not be any program. You cannot have the immunization program without adequate vaccines. And the next slide. So for more information, you can of course reach out to, you can reach out to us in UNICEF. That's the email you can write to, but we'll also put our personal emails on in the chat. And also you can go onto the People That Deliver website, www.peoplethatdeliver.org, and also info@peoplethatdeliver.org. Also, there's a Twitter and LinkedIn handle where you can also learn and get to know more about how you can be supported, and ideas, what lessons learned in other countries. And I hope that this short session has been helpful. But now over to you, Liz. We want to really hear from countries. Thank you so much.
Wonderful. Thanks so much, Adebayo. And I think we have a couple questions that have come in, but again, I would encourage you to either share them through the Q&A function or through the chat box as well. So I think we do have a question around if a particular country is experiencing all four challenges, so skills, staffing, working conditions, and motivation, and what happens if all of those apply. I don't know if, I think this was during Dominique's portion of the presentation, if you want to take that one.
Yeah, thank you, Liz. Yeah, I realized that in the presentation, I only spoke of the example of staffing, but if if there were challenges in all four pathways, then there's a need to look at this in a very systematic way. And I would say, for instance, with skills, with COVAX, with new treatments coming in place, there's new rules and regulations. So there's a real need to look at how to do some on-the-job upskilling. And we've seen that new skills are necessary now in strategic purchasing and procurement, data science, analytics, of course, outsourcing, contracting, monitoring. And therefore, especially when it comes to skills, we're looking at, how can you go back to the slide that, the bio was just showing, where there's a need to look at figuring out what the gaps are. And so those gaps can be shortened by, looking at taking courses with professional accreditation, or doing some short technical courses, or even getting some academic accreditation. But there's also, there's a lot of knowledge sharing being done on online communities such as Boost. So there's a way to look at the skills pathway. When you look at the working conditions pathway, there's a real need to look at sort of the well-being, the safety protocols, and of course the psychosocial support that health workers need. And so there's a variety of tools there as well. Specifically, the WHO issued guidelines for health workers, we're probably all very familiar with. There's also guidelines on how to prevent the spread of COVID-19 in the workplace. There's considerations for public health and social measures in the workplace in the context of COVID-19. And then there's a few partners that we know, such as the USAID GHSC PSM project has put out guidelines on safety protocols, as well as even like something like social stigma that we know is an issue. And then when it comes to, for instance, motivation, as Adebayo also mentioned, there's a need to look at sort of non-financial incentives. There's also, there's a need to look at sort of perhaps temporary salary increases, or hazard pay, or compensation for overtime, or other allowances, such as additional time off. Because we know that when it comes to sort of motivation, that financial incentive is not always what is most important. A lot of studies have shown it's those non-financial incentives that are a motivating factor. There's also, as Adebayo laid out, supportive supervision is an important aspect that needs to be looked at. And then, of course, there's the allowing workers to be involved in the decision-making processes, sort of developing new working processes, new SOPs, perhaps making changes in shifts and work hours and the work environment. And with that, there's a number of tools that are available that UNICEF has also developed, such as the Performance Management Toolkit for Immunization Supply Chain Managers, and then supportive supervision of supply chain personnel. So that's just some of the ideas that I had. Adebayo?
Yeah, thanks a lot, Dominic. And those are great ideas. Just adding also a few points, because when a lot of people on the call would say, one of the questions we get a lot is, oh, we don't have money to implement it. I don't control the money. So how do I do that? I think the first step around, if you have challenges across all of this, is to understand, because the question leadership will want to ask from you at national level is, what is the problem? So you need to be clear about the problems you have. And I just want to mention to you that People That Deliver has been supporting countries to conduct the human resource for supply chain assessments. And the good thing is it's also, there is the rapid tool that you can use to really, understand where you are as a country at all levels. So you can think of using that to really assess where you are and what concrete actions you should take. We also have the supply chain maturity model assessments that you can also, carry out, which provides a cost review to where are the areas and what should you do to move on to improve them. The other point also is based on, after you've done this, then you go on to advocating for across all of these various elements. But there are also little things you can do to improve staffing. As I said, for staffing, you can think of tax shifting, you can think of secondments, you can think of ad hoc staffing, which is something you can also look at country level. For skills, you can also, in addition to the point Dominic has made, you can look at job aids. Job aids are very easy. I've been to many facilities and I've been to many countries, and one of the most effective things I've seen is the use of job aids, pasted on the wall, pasted in the warehouse, pasted in the cold chain store, and it's really effective. You really don't understand the power of a job aid in the language, be it in Arabic, be it in Swahili, be it in Hausa or Yoruba, those, or even French, that the power of those tools are quite important. And in terms of working conditions, just understanding that many times infrastructural changes might need a lot of money, but once you are able to advocate and communicate it to the necessary authorities and constantly do so, I think that would also bring visibility to to the challenges also. So those are just few ideas that you can also look at without breaking the bank. So thank you so much.
Thanks, Adebayo and Dominique. We still have a few more minutes, so if anyone would also like to maybe share out some of your own innovative training methods, we'd love to hear from you. You can also raise your hand and we can unmute you. So I'll just give a minute or so if folks want to share their experience. Great. It looks like we have a hand raised. Oh, maybe not.
Liz, I see the question about if we have suggestions for more innovative training methods to improve retention engagement. So, the way I would answer that question is that there's a lot of sort of training available, free and accessible to anyone. If you look at the Open WHO, for instance, lots of new trainings are available on that. Agora, which is a UNICEF training platform, is also free and available to the general population. And there's a lot there available that would be interesting, especially when you're, as you say, you don't want to necessarily leave base. And so all of this available online. And perhaps those that are on this community are also on the IPHL board. And there you'll find a variety of trainings being promoted, which we also stand behind. There's just at this time many sort of different trainings available, especially as we are now into the 8th month of this COVID pandemic, and we're just seeing a lot of digital opportunities. Adebayo, did you want to add on anything to that?
Thanks, Dominic. For me also, it's just for everyone to realize that there are tons of training opportunities, but you need to, get yourself involved in the right places and in the right groups or communities. The Boost is a great platform, and Boost has a lot of leadership programs and webinars and also access to experts, because you don't know everything. You can also always leverage on those methods. And also, I would want to just that we can always look at resources that are already available for insights, and I think that's very important. The IAPHL, TechNet 21, Boost, these are kind of very great communities that we can also leverage and check out to see what is available. But it's important that we take that a proactive step around that. I'm going to paste a list of places you can go to. Also, if you need to get more information, that is already done. Thank you so much.
Thanks. And it looks like we have a couple additional questions coming in. We have a question from Adriana. For future new COVID-19 vaccines, what do you see as the most important challenge to overcome related to supply chain workforce?
Okay. Okay. Let me start, and then I would allow Dominic also to add a few points. For the future new COVID vaccines, there are two things now. First, we are still dealing with the issue of health worker safety, making sure that people's health is is in place. So I feel one of the first things is making sure that we prevent infections within the supply chain workforce. But the other two things that would come up is the additional workload. And that's why we've mentioned that it's important that what will be the additional workload, additional capacities that will be required, and also for you to seek innovative ways to address those issues. And I've mentioned secondment, task shifting, and also and task shifting around those. So it's important that we look carefully at those elements as we think about the new COVID vaccine, because let's look at, for example, the cold chain facilities. Probably there will be need for increase, and also it's also important to look at how do we manage scheduling, because some places might say you might not come to work at the same time, so you need to look at scheduling also, and that's very important through it. Dominic, do you have anything to add to
that? Thank you, Adebayo. No, I mean, really very much we need to look at workload, responsibilities, and future staffing needs. That's our main message here, because we know that there's just so many disruptions happening to the supply chain, and the like I said, the operational environment is very complex. So we suggest really looking at using a variety of the different tools that we have suggested to do that future forecast staffing needs. Yeah.
Great. Thank you both. And it looks like we have some activity in the chat as well. Laura says, in India, our team did a station approach for face-to-face training for a rotavirus vaccine introduction. And this can be adapted with social distancing and outdoors, well-ventilated area with PPE and small groups. And they've included an example, a link there. So thanks for sharing with the group. And then I think before we close out, we just have one last question, and this might span a little bit beyond this webinar into the question around data, which is sometimes an issue in the supply chain. So the question comes from Inda and is, how is the best way to improve the data culture? She says, because no matter how excellent and how good the supply chain tools are, without the data culture of recording and reporting, there will be no data visibility. Any insights there? And again, this might be a little bit beyond what we discussed today, but would love to hear those linkages.
So let me start. I would say that And I like the fact that you brought the issue of data, because when we talk about HR planning, data is quite very important. The question I want to find out from us is, how many of us actually know the current human resource we have across the EPI program and what we would need in the next 5 years? These are, key elements of data that is applicable to HR, but also in terms of the culture and how do we improve data culture. Now, funny enough, I would like to say that from the experiences I've seen in the countries that we've worked with, one of the major areas around data culture is the skills of the people in managing data, in terms of data, capture, in terms of recording. That's when we talk about the capture data recording, but also, being able to, interpret and analyze that data. And the last point is around being able to use that data to make decisions. A lot of efforts are being focused on building human resource capacity to record, to capture data. But many times there is really very little being done to help people interpret and analyze that data, and also ensure that there is adequate platform to share that data for decision making. So while people talk about how do we improve the data culture and visibility, we focus so much capacity on how do we fill forms, how do we record, how do we report, but we do not focus a lot of energy and human resource capacity in interpretation and analysis. And also, how do you make sure that what you've captured is put in a format that is, that brings about visibility at that same level, but also at the upper level. And the last point is around the feedback mechanism also. So for me, it also boils down to what we talk about HR in terms of, first, the need for us to have data to plan accordingly, data in terms of our coaching capacities, in terms of our inventory, in terms of distribution capacities, transport, in terms of the general immunization system in the country, but also the ability of people to analyze the data, interpret it, analyze it, and then being able to identify relevant channels to share that data. So that's my point. Dominic, do you have any point around that?
Thank you, Adebayo. I mean, I'm fully supportive in what you're saying, in that when we look at sort of the skills and competencies that are necessary for the future supply chain manager, it's all about data management, data quality, using data to make informed decisions. And so we need to be working to develop those skills, upskill people with those skills, because otherwise, data, bad data comes in as bad data going out. And so with that, yeah, I fully support your answer.
Great, thank you both so much. I know we're at the top of the hour, so I want to go ahead and thank you guys so much for the presentation today, and for sharing your expertise and resources with us. For those that are on the call, we will be sharing out the presentation, recording, and the additional resources that Adebayo and Dominique have shared with us today and over the next few days. I would also encourage you all to share your feedback with us in the survey that will be sent out right after you close out of the webinar. Your feedback is really important to us. We want to make sure we're continuing to deliver helpful webinars to you all. And with that, thank you and enjoy the rest of your day.
Thank you so much, Liz, and thank you, everyone.
Same here. Thank you. Thank you, Liz. Thank you to the Boost community for allowing us to speak today. Thank you, Adebayo.
Thank you. Thank you so much, Dominic. Thanks. Bye.
Bye-bye.
Bye.